Om Dhanvantrai Nama to all, and happy Ayurveda Day of 7th Ayurveda Day. And it's a second chance for me that Dr. Shekhar gave me to speak on Ayurvedic cardiology again. So let's get on the point of Ayurveda. So my main topic is Shirodhara in essential hypertension. So, as all know, hypertension is not a disease, but it is a dangerous symptom which can cause cardiomyopathy and so severe cardiovascular diseases like MI. The previous speakers also talks about cardiac disorders and basically of Bataj Hridroga. So MI and the cardiac diseases causes from hypertension, and hypertensions came from nitya ahar vihara, that is improper diet and lifestyle disorder. But in India here, we try to find that how we can make Shirodhara as an essential medical system with integration form of Ayurveda, with use of interventive echo machines, ECGs, and with Shirodhara, with Virechanam, and with the Raktamokshanam. So it is very important. I used to do Shirodhara and Virechana and Raktamokshana on my IPD patient under medical insurance. I used to see, I used to choose 26 patients, in which 20 patients, they choose Ayurveda like Shirodhara and Virechana for decreasing and balancing the cardiac loads. So the most important thing that how Shirodhara can help to reduce the hypertension and balance the hypertension. So in India here, as authentic Ayurveda tells, that Shirodhara balances the sparshan indriya, the dermatomes of the external skins, and it induces the acetylcholine, that is sparshan indriya of every nervous tissue from the pinch of your finger to the brain. So it is very fascinating that 5,000 years back ago, the dhara, there is a force of dhara that makes the sparshan indriya opens from the head, and it balances the acetylcholine process in the blood form and in the cardiogenic muscular system. And I will talk about also Virechana and Raktamokshana, how we manage the emergency cardiology in Ayurveda. So when the patient came of MI and cardiomyopathy, whether it is chronic, whether it's acute, there is a very common symptoms came that patient says that I cannot weigh up to stairs. When I go to 2 stairs or 3 stairs, I like saans phulta hai. The patient tell you that is the common basic symptom of Vataj Hridroga that is mentioned in Charak Samhita, Sutra 17, in Hridrog chapter. That is very fascinating, and that is fascinating too that today's people, whether the patient is from Africa, the patient is from another countries toward the seas, they have similar symptoms of Vataj Hridroga that was fascinatingly proposed by Charak Samhita 5,000 years back ago. There was one of my patient from Africa. He has a cardiomyopathy and is a ventricular failure. And when I saw all the symptoms of that patient, and I used to match that symptoms with the shloka of Vataj Hridroga, I was shocked. The symptoms of that the Afro-American and the shloka matches, and I used to diagnose that it is a Bataj Hridrog. And you can see, and in India we used to research that how we can translate and how we can catch the Vata, Pitta and Kafaj Hridrog on ECG level. So when we go for a cardiomyopathy, because in India here and in US too, there are so many Vataj Hridrogas. Vataj Hridrogas, as already previous lecturer says, that Vataj Hridrogas are variously increasing day by day. But it is very important, as I am an Ayurvedic cardiologist, so it is very important to understand that Vataj Hridroga is different in gynecology, is different in pediatrics, it is different in cardiology. That is all about Charak Samhita told us about that. And the role of Virechana is very beautiful to escalate the cardiomyopathies, whether it is due to hypertension, whether it is due to tension. The patient should follow, he can choose a season in summer and in winters to follow Virechanam with Shirodhara. It can reduce and balance the hypertension, the blood flow, the rakt and rasa flow in the arteries and in the vessels, and it can prevent the MI and cardiogenic shocks very frequently. Third thing is Rakta Mokshana. When the patient came to us with a hypertension crisis with Uch Rakta Chapa, so we used to do Rakta Mokshana from Manya that is a carotid artery. So when we used to do that Manya the Rakta Mokshana from Manya beautiful result came after 5 minutes, and patient relaxes after 15 minutes. So in India, we are supposing Ayurveda Hargar in every home, to every brain, to every people and to every patient, by connecting these things to integrated approach, not allopathic approach, just a instrumental approach. We can see through the Dopplers, we can see through the echoes that Virechana can balance the thickness of the ventricular muscles through Virechana, Shirodhara and Rakta Mokshana. I usually do to practices all these things. So in India, we try to hypertension free India and hypertension free world all over the globe. So thank you, Dr. Shekhar. Thank you so much to give me a chance to talk on Ayurvedic cardiology. And thank you so much. Thank you so much again. And happy Dhanteras to all, and happy Dhanvantri. Thank you.
Next, 87, Dr. Vishwanath Gudadhar.